Okay, afternoon everybody. So we did this, what, a couple of weeks ago, was it?
Last week.
Was it? Okay, and not long after we did it, the guidance changed. So we thought we'd do it again using the updated guidance from Public Health England this time. So as Anthony said, a short presentation, I think I've got 7 slides or so, and then we'll go to questions. So there we are. We'll do go through the new PPE guidance from Public Health England and try and give you some information about what it means in practice. We'll just remind you about the arrangements for supply. There'll be questions and then we'll put it up on YouTube. Okay, so there's a couple of graphics from Public Health England on use of personal protective equipment. This is the first one, so our split person. Most of you guys in social care are going to be working on the left-hand side, so the orange half person. There will be a few people who are doing aerosol generating procedures who will be looking at the other side, the green person, but we're going to focus on the orange scenarios for this afternoon. Just before I go through when to wear the various bits of equipment, a lot of the guidance refers to confirmed cases and possible cases also get called suspected. It's the same thing. Just to remind you that a confirmed case is a case of coronavirus COVID-19 infection that's confirmed in the laboratory, and a possible or suspected case is just a symptomatic diagnosis. So it's someone with a new onset of persistent cough or fever above 37.8 degrees centigrade. So that's what they're talking about when they're referring to these possible or confirmed cases. So on the left there, we can see that for most of the tasks that social care staff will be undertaking, so this is direct contact with people to provide care within a radius of 2 meters. What people will need to wear is gloves and an apron, and those are your usual bits of kit really. A fluid resistant surgical mask, and then eye protection based on a risk assessment about the risk of splashes of bodily fluids. Probably won't need to use them for most of the things that you're doing, but there will be occasional interventions where it might be worth wearing eye protection in the form of glasses or a visor. Bit of advice at the bottom, so washed hands before and after all contacts and after removing the personal protective equipment. Clean the equipment you're using. There's advice on our website and nationally about how to clean stuff. Take it off safely, and we gave advice last time about how to dispose of waste, putting it in bags, leaving it for 72 hours. That hasn't changed actually. And this one about taking breaks and hydrating yourself, not so much for the sort of basic PPE, but if people are using the enhanced PPE for aerosol generating procedures, and it can get pretty hot in there, so just make sure that your staff bear that in mind. I hope that one's reasonably clear. The other graphic that Public Health England have usefully released is this one, which on first glance can be a bit daunting, but I will take you through it. And this basically takes you through a range of settings and contexts that are relevant to, I think, most of what social care providers will be doing, and then gives you a little tick box about the bits of equipment that are recommended. I'll go through the rows one by one. So the first one is your aerosol generating procedures, and there it is recommending gloves, a full body gown, a filtering respirator, that's an FFP3 mask, as well as eye and face protection. So say you may be doing a few of those, probably not too many, but that's the advice for those. Then you've got the setting which on here is called primary care, ambulatory care, non-emergency outpatient care, and other clinical settings. Probably most of those don't apply directly to you, so I'll skip over those 2 rows. The ones we're interested in is individual's own home and then community care home. So for individual's own home, we're on row 4 now. So direct care to any member of the household where any member of the household is a possible or confirmed case. So that is where if the person you're looking after is a possible or confirmed case, or if there is someone else in the household who is sick as a possible and confirmed case of coronavirus COVID-19. So what we're looking at there is gloves and an apron and a fluid-resistant surgical mask with, as I say, eye and face protection considered based on a risk assessment about the danger from splashes of bodily fluids. Next one in that category is direct care or visit to any people in the extremely vulnerable group. So this is a group of people that are defined on the website. We'll circulate that in the link. But it's people, for example, who've had bone marrow transplants, people who are on immunosuppressive therapy for things like cancer, and other people with medical conditions that makes them extremely vulnerable to coronavirus COVID-19 infection. And when looking after those individuals, the recommendation is that staff should wear gloves, apron, and a surgical mask for all of them. And this is about protecting them rather than about protecting the staff. So it's for if anyone in the household is in that category, wear the equipment, and it's to stop us introducing infection into that household. Next one is home births. I don't think that's going to apply to very many of you, so I'll skip over that one. So that's the ones that are most relevant to home care, personal assistance, those sorts of services. The next one is care homes. So this is where we are providing care in a facility with possible or confirmed cases, and there is direct resident care within 2 meters. It's gloves, apron, and a fluid-resistant surgical mask. In those settings, the surgical mask can actually be worn for what's called sessional use, which means you put it on at the start of the day and you take it off at the end, rather than need to change the mask for every single person. The exception being is that if you move from a possible or confirmed case to someone else without symptoms, you should change all the personal protective equipment. That should hopefully cut down on the use of masks in residential and nursing homes. As I say, if you're only using one for the day or only changing it a couple of times if it gets uncomfortable, rather than having to change it as you move between every single person. I'm sure there'll be questions about that. I'll move on now to a couple of other what we've called precautionary measures. So where there are care home outbreaks, so that's a care home with 2 or more cases, what we're suggesting is gloves, gown, and a surgical and a fluid repellent surgical mask, again worn sessionally for the care of all residents. Again, change the mask after caring for symptomatic people. And in all cases, so this is in people's homes or in care homes, where we think there's a likely risk of contamination with splashes or droplets of blood or body fluids, think about risk assessing those individual circumstances and whether to use fluid repellent surgical mask with or without eye protection for that care episode. Again, that will be, I think, a minority of the kind of interventions that social care providers are doing, but not a very small minority, if you can understand that. So there will be some of those care tasks where you want to consider that. Arrangements for supply now. So the advice remains, in order to get hold of PPE, contact your normal suppliers. There are then 4 nominated social care suppliers, and details of those are on the website. If you can't get any joy out of those, call the National Supply Disruption Service. There is apparently a new national electronic order system going live either end of this week or early next week. I think you'll receive an invitation directly from the national system because you're registered with the CQC. We encourage you to register with that, and we'll get out more details as soon as we get told more about it. We in the council will keep trying to get hold of as much PPE as we can and make it available to care providers who are dealing with cases and who can't get stocks from those sources above. We've enhanced access to PPE. We've got more local supplies, longer opening times, and hopefully faster response times. Just to stress that we do have to balance demand and supply. So we've got a reasonable stock, but it is limited, it is finite. and it is important that we use it responsibly in line with PHE guidance. If we don't, there is a risk that it will run out, and that will mean that we don't have PPE for those staff who really need it. So we are not yet in a position to be able to assume that the government will just keep supplying us infinitely. We do have to think carefully about how much of this stuff we will use. Obviously, we'll keep our advice under review. Just put in this note that council supplies are for care providers only. The details of the supply chain have found their way onto Facebook one way or another, so we have had members of the general public pitching up at our supply sites, which isn't necessarily very helpful. So if you can be discreet about your circulation of those arrangements, that will be appreciated. And again, we'll update our advice as the epidemic unfolds. So that is pretty much all from me. We'll go to questions and answers now. So who have we got, Anthony?
Thank you. Yeah, we've got quite a few questions come in, particularly over the last 5 or so minutes. Just to quickly say, apologies if there have been any audio issues at the start. I know some of you messaged to say you couldn't hear. I think sometimes we're at the mercy of the technology and network connections, so there might have been a bit of lag at the start, but I've noticed most people have commented now saying the audio is back fine, and we've had plenty of questions, so that shows people can hear us. So Alicia's kicks things off. She says, when you refer to possible cases, is this a person who has symptoms?
Yeah, so possible cases is what we said at the start. It's people who meet the case definition of either a new persistent cough or a fever above 37.8 degrees centigrade.
Helen has asked, we have a service user who has a waking night sit. We have to put on and take off his, I'm probably going to butcher this, sorry, this BPAP mask, and are there overnight. Could we have some advice on the PPE that should be worn? He's not displaying symptoms at present, but is classed as extremely vulnerable. What should we do about PPE overnight?
So if he's in the extremely vulnerable group, I hope people can see the, can I see this slide?
I can see that one. Right. Yeah.
So I think he would fall under row 1, 2, 3, 4, 5 there. And so you'd be looking at gloves, apron, and fluid-resistant masks for looking after him. And that, as I say, is to protect that individual.
A couple of people have commented regarding PPE packs or supply of gowns. A few people saying that they don't have those currently. So any advice on getting gowns if people need them?
So we can have a look and see whether we've got gowns. So I'm not expecting people to be using huge numbers of those, but I note the chap who's inquiring runs quite a big care home, so you know, in a big care home there will be a few aerosol generating procedures. We'll have a look at our supplies and get back to that chap.
Michael has asked, the use of surgical masks in direct care for shielding, does this apply to supported living services?
Yes, it would do. So it's anyone in that shielding group, in that extremely vulnerable group. Row 5, as of this slide, would apply, whether they're in a care home, home care, supported living, or wherever.
Les asks, what is the specification for a sessional face mask?
It's the same fluid-resistant surgical mask that people have been using for episodic care. It's the same piece of kit.
So Michael again has asked, would eye protection apply to issues such as people at risk of spitting at others, airway suctioning, and people who struggle to manage coughing and sneezing?
It might do. I think you'd want to do a risk assessment on an individual basis. Again, there are some people who are at risk of spitting, but they don't do it all the time. You know, it tends to fall in line with their behaviours. So if you think that is a risk given how that person is behaving at that time, then think about eye protection. If they're quite calm and quiet, probably wouldn't be necessary. I mean, it does take a bit of judgment, some of these things. Again, what we need to do is to balance the imperative of trying to protect staff against the fact that this kit is finite, and if everybody starts using it for everything, it'll run out and we won't have it for those who really need it.
Thanks everyone who sent questions so far. Just to say, we'll try and get to as many as we can before 5 o'clock. The ones we don't answer, we do look at them after the session and note which ones we didn't get to, and sort of try and get some guidance out based around those. So if I just go through now. So Louise has asked for a bit of clarification around the fact that they've got, to clarify, if we have a suspected case in the home, we isolate the individual in their room and assign one member of staff to care for that person. Do the other staff working with the other clients need to wear PPE, and do other residents need to wear a mask in the general areas?
So I would say not if there's one suspected case and you can isolate them effectively. So you need to use PPE for caring for that person, but for everybody else, it should be okay. If there is more than one suspected or possible case, we are now saying probably best to use PPE for the care of everybody.
Henry's just asked, do you mean staff in care homes should routinely wear masks even where there are no confirmed cases?
No, so if there are no confirmed and no suspected cases, you don't need to wear masks. If there is just one confirmed or suspected case, use a mask for looking after that person. If there are 2 or more confirmed or suspected cases, probably best to use masks for looking after everybody.
Donna has asked, COVID is now RIDDOR reportable. Can you clarify the definition of exposure to COVID-19 as the example given is based in a lab?
So I'm not very familiar with RIDDOR, so you might have to check this one out. I suspect that exposure, if it's defined in RIDDOR or anything like it is in this Public Health England guidance, it talks about care for people within 2 meters. So it's not the scenario where, I don't know, let's imagine you've got a care home receptionist and people are walking past at a distance. That wouldn't be it. It wouldn't be the cook in a care home who's happening to serve a bit of food, but the residents are, in a different room. It's for the care staff who are up close and personal to people for a reasonably prolonged length of time.
So Mandy's asked, can we please confirm masks are to be worn for residents with symptoms only and those who are classed as extremely vulnerable as recognised by Public Health England or GP?
So again, if this is a care home scenario, we're looking at masks. If there's one case, just for the resident who's got symptoms. If there are no cases, don't need to worry about it. If there are 2 or more cases, probably need to wear them for all residents, but you can wear them sessionally. So you can wear one mask for pretty much the whole day, except obviously for changing it for comfort and for changing it after you've looked after a symptomatic person.
There's been a few questions around use of the term gowns. I think some people are saying in the guidance it says aprons. I think it says gowns in the slides. Just a bit of confirmation whether you mean the same thing by those.
Yeah, so there we are. So you only need gowns if you're doing aerosol generating procedures, which is the guy on the green person here. For most of what you're doing, so the orange side lady, it's just a disposable plastic apron.
Amy's asked, would you recommend using surgical gowns when in communal areas? I have some extremely vulnerable residents who are symptomatic and are mobile. We are barrier nursing as often as possible. However, without complete sedation, we are unable to isolate to one room. What do you recommend? Public Health England are aware and have arranged testing. However, what would you recommend in the meantime?
So again, just get to distinguish between gowns and aprons. You only need the gowns for aerosol generating procedures. So again, some of you will be doing a small number of these. Most of you won't be doing very many at all, if any. So we are talking mostly about plastic aprons, which are the green disposable things. So that question was about in communal areas. For most people who are working in communal areas, you wouldn't need to wear PPE. If you've got people who are wandering about in communal areas and you're having to actually, I guess, shepherd them around and care for them, the person who's doing the caring and the shepherding around would need to wear PPE in the circumstances that either they are symptomatic or you've got 2 or more cases in the home.
There's been a few questions just around obviously additional PPE bringing additional costs for agencies. Just a sort of a general question, if there's anything we signpost to in terms of funding or costs to cover these.
Yes, so we've put out letters, I think a couple of weeks ago, with some offers of funding to the whole care sector, which are designed to cover a range of additional costs arising from coronavirus COVID-19. And the other thing we keep getting asked about is fee uplifts. Hopefully those letters should be going out this week. Apologies that it's been delayed. We were just about ready to go before all this hit, and now we've had to take this epidemic into account. So those should come to you later on this week.
Kimberly's asked, should staff be wearing masks for those who have been recommended to self-isolate by the government and so therefore being isolated in their bedrooms? Okay,
so if bit of subtlety in here, Kimberly, because actually pretty much everyone's been asked to self-isolate by government unless they're doing essential jobs, obviously like yourselves. I think what you're talking about is the cohort of extremely vulnerable people, which again is those people who've had bone marrow transplants, immunosuppressive therapy. We'll get a full list of those up, so you've got those categories. It does say again on the Public Health England guidance that if you're looking after people in that extremely vulnerable cohort, you're looking at row 5 on the slide you've got there. So whether they're at home or whatever, it is gloves, apron, surgical mask.
Carol's asked, are all staff who are not suspected but have a historical persistent cough, do they need to self-isolate?
I would say not. So the case definition says new persistent cough. Again, so if it's someone and their cough is the same as it's always been, I'd say they were fine. If they've always had a cough and their cough has suddenly got a lot worse, maybe consider them as a case. I know some of these are a bit tricky, so a bit of common sense and judgment, I think.
Lou has asked, there is some conflicting information about whether chest compressions are now considered aerosol generating procedures. What is your understanding on that?
Not seen that, so I'll take a rain check on that one and come back to you.
Gary's just after a bit of clarification around sort of close, masks and close proximity. He's just asking, so if we are in close proximity to service users in communal areas and close personal care, but we have no cases or suspected cases, do we need to wear the surgical masks or not?
If you're in a care home, then no. If there's no one in the care home who is a suspected or confirmed case, you can just get on as normal.
Misty has asked, or said, hello, you mentioned there will be an electronic order line. Is this through the national distribution? And do we just have to wait for them to send the information to us?
So what we were told is that there's a new distribution service coming online and that care providers would get details of it. That's pretty much all we've got at the moment. So as soon as we know more, we'll let you know. I think we're expecting they contact you directly as CQC registered providers.
Wendy's asked a few questions around home care, and particularly around the use of masks and the regularity in which you change them. She said, what's the difference in wearing the same mask in one house to another? And say, why just would the mask need to be destroyed and not the rest of the clothing?
Might have to come back to Wendy on that one.
We'll look at those after and try and get some guidance out after the webinar. Thanks for your question, though. Francis has asked, what happens at the end of illness? She goes on to say, carer just coming up to 7 days, still has a cough, getting conflicting advice from doctor and 111.
The advice we've had from Public Health England is once a person has passed 7 days from the onset of symptoms and they are 2 days without fever, then they can go back to work. Some people do have a residual dry cough for quite a long time, but we can reasonably safely regard them as non-infectious if it's 7 days after the onset of symptoms and 2 days without a fever.
Okay, so it's 5 o'clock, so we'll just do a couple more. A couple of people saying thanks for the webinar, they found them useful, so thanks for letting us know that. We do appreciate the feedback. Lisa's asked, would clients who are classed as high risk due to health conditions or age receive a letter from the NHS, as families will state their dependent is high risk / shielding?
Yeah, so if you can imagine 3 categories of people, so the lowest risk is most of the general public, fairly young and fairly healthy. Your next step up is people who are at higher risk, and people at higher risk are people who are elderly, so typically over 70, and people with a whole range of medical conditions, heart disease, lung disease, kidney disease, the sort of things that they get flu vaccination for. And then right at the top, you've got this cohort of extremely vulnerable, who are the bone marrow transplants, immunosuppressants. The shielding only applies to the extremely vulnerable, not to anybody else, and the letters from the government have only gone to the extremely vulnerable people. So in Staffordshire, there are about 14,000 people in the extremely vulnerable cohort. There must be probably another 150,000 who are higher risk by virtue of age or other medical conditions.
Just a final comment from Julia, who said the webinar is very useful, but as yet not received YouTube access to the previous webinar. Just on that, Julia, the previous webinar on PPE, it was on YouTube, but as Richard said at the start, the government have updated the guidelines since, so that's now just been removed from YouTube, and this one will subsequently go on to replace that. And a link to that should be emailed out to you in the next few days. If not, please get in contact and we can arrange to get a link across to you. Right, that will be the end of today's session. Thank you to everybody who's logged on and asked a question. Again, just to reiterate, apologies, we try and get to as many as we can. We can't get to all of them, but we will try and get some guidance out in the next few days based on the questions we've had in and the ones that have gone unanswered. But thanks again, and we hope you all have a good week.